I check on. I think we were approved, but.
Well, hello and good evening, Plainfield. I am Mayor Adrian O, Mapp, and I am here this evening with Director Shep and with Dr. Kerri Powell, who is the Executive Director of the Plainfield Neighborhood Health Services Corporation, known to many of us as the Plainfield Health Center. And we're here this evening to speak to you about the vaccine. And I know that the last year for us and for you has been a challenge. We've experienced a great deal of loss. Business has been interrupted and things have not been as we knew them to be prior to March of last year. But a lot has changed, a lot has improved. Sadly, I must say that as of yesterday, we've had 5,655 positive cases of the virus, and we've had 159 deaths. And so we are working very hard with the limited resources that we have to do the very best that we can. We continue to assist our seniors every day with registration and helping them to get the vaccine, as well as other members of our general population. So we're doing the best that we can, and we couldn't do it by ourselves. Shep has been working around the clock. He's like the Energizer Bunny. He never stops. And he is ably assisted by many members of our staff. And the relationship that we have with the health center and with the county has been very essential in order for us to deliver the doses of vaccines that we've been able to deliver. So I will turn things over to Shep at this point, and then he will introduce Dr. Powell. Shep, over to you.
Thank you, Mayor. Good evening, everyone. Good evening, Dr. Powell. Thank you for this opportunity to be on this live stream. Quickly, I'll say that had it not been for the partners that we found in Dr. Powell at the health center and with members of the county, I shudder to think where we will be at this time. It is because of partnerships like that we were able, like the mayor said, to get individuals vaccinations when they have gone to 5 and 6 different places trying to get a vaccination. I'm not going to spend time on talking about those challenges, but you can see it in the news, you can see it everywhere. And I think that one of the greatest things that we've been able to do is work with Dr. Powell and work with the health center to move individuals from searching for vaccines to actually getting the vaccine. And that has been tremendous in the communities such as ours. And so I think quickly I met Dr. Powell in 2018. We talked about how in 2019, in 2020, no, 2019 and 2020, we were going to do some rebranding because this new empowered and wonderful health center, and then we had COVID-19. And then, I was amazed at how the health center under your direction just kind of retooled and pivoted and started with the testing and the pilot programs for testing that we partnered with through the city. And it was just, if I had to be with people during this crisis, I'm glad I was with you, and I'm glad you were a partner for the city. And so I'm not going to talk too much about that. I do want you to talk to the residents about vaccinations and the importance of vaccinations. And hopefully you will touch on the fact that in communities of color, why we need vaccinations so badly and why it's important that we get them. And so I'll turn this over to you, Dr. Powell.
Thank you so much, Shep. And I just wanted to say thank you to Mayor Mapp and also to Shep for having me here this evening, and also for, again, just to reiterate the partnership. We are very happy and pleased to be able to become partners, not just with this pandemic, but in other areas. And we're looking forward to expanding those services and expanding access. So just thank you so much for having me here. I feel that's an honor to be able to talk. One of my missions when I think about this pandemic, it concerns me the effects that it has on people in general, but people of color and the underserved in particular. And so this is, I find, a great opportunity to be able to speak. Just a little background about myself. I graduated from Howard University College of Medicine, and then I went on to do my residency at University Hospital, UMBNJ in Newark. And I have been at the health center and functioning now as both the CEO and the CMO, and have had a lot of experience dealing with this pandemic and vaccines and COVID. And I just wanted to share what I know with you so that you will feel more comfortable and you will feel armed with knowledge. That's the important. So I'm going to do a slide presentation first, and then we are going to have a question and answer session afterwards. So you will have an opportunity to ask your questions, and I will do my best to answer them. Okay. Okay. I just wanted to start off giving an update on the infection rates, and Mayor Mapp has come up with a even more update. My data is from March 21st, but just showing in general Plainfield's cases and deaths in comparison with the county, with New Jersey, and the national death rates and also the cases there. Right now, New Jersey's positivity rate is about 8.42% in general, and our county is 8.18%. There is an increasing amount of cases that are happening, and our percentage rates are increasing, which makes the urgency of us having this discussion and improving our vaccination rates even more important. I also wanted to touch base on COVID-19 variants. It's a lot of conversation that has been going on nationally. And basically, variants are just replicate versions of the virus. And viruses behave like this in general. This is not unique to COVID-19. Viruses, the way they try to survive is to keep reproducing themselves, and they're very bad copy machines. So every time they copy themselves, which means every time someone gets infected and they have to copy themselves, they make mistakes. And those mistakes are what variants are. They tend to change something about them that makes them a little different. And currently, the variant strains that are here in the United States are B117, P1, and B1.351. And these are just the variants, but these are the counties that they're currently present in. Really, the significance of that when you're talking about variants is, does it make me sick or sicker? Does it increase my chance to die from the virus? And does the vaccine still work if these variants exist? And so I wanted to just go over the different vaccines, the three different vaccines. That's the Janssen, the J&J, the Moderna, and the Pfizer, and how they measure up against these different variants. The Wuhan H1 is the predominant strain that's in the United States, and you can see the vaccines pretty much hold up against that. In United Kingdom, the B117, which is currently in the United States, there's really no change with the vaccines effectiveness against that. Now, with the Janssen and the J&J, they were doing their studies in South Africa, Brazil, and United States at the time the variants were becoming to emerge. And that's why they have specific data on their effective rates against that. The Moderna and Pfizer are basically doing laboratory tests against these variants to see how effective they are. But all in all, right now, vaccines, even with these variants, will keep you from dying and keep you from having severe disease. So you can't go wrong with any of the vaccines that you pick. Again, I wanted to talk about the importance of COVID-19 in the minority community. I know that you've heard a lot of information and a lot of talk about how it's affecting these populations, the Black and brown population. Black and Hispanics are 2 times more likely to die from the vaccine. Hispanics are 3 times more, and Black and Hispanics are 3 times more likely to be hospitalized for the vaccine. And so it is imperative that we get ourselves protected because we disproportionately are becoming ill, having severe illnesses, and dying from this disease. And what I wanted to talk about, some of the mistrust that's in the minority community, and it is rightfully so. We historically, in this country, we have been experimented on, we have been misused and mistrust, and you throw things out like Tuskegee experiment, but you don't have to go far. Many of you, as myself, have had experiences in hospitals or in healthcare that have not been pleasant. And so, understandably, we are mistrustful of the vaccine when it comes to our community. But what I wanted to point out, and for the first time, not the first time, but more than ever before, that our we have a front line to the creation of this science. And I wanted to bring about or talk about Dr. Corbett because I am very proud of who she is and what she has done. And when we talk about mistrust and not understanding or creating this science with us in mind, she has been at the forefront. She's at the NIH's leading scientist that is researching the Moderna vaccine. She's very accomplished, very brilliant, and she has been there from the beginning, developing this vaccine technology along with many others throughout the world. But that is one of the reasons why this has, that I'm very proud to say, we have a front seat at the table. And in addition to Dr. Corbett, my colleagues on every different level, people of color, have been looking into the data, sitting in on conferences, and screening this to make sure that these vaccines are safe for the minority community. So vaccine types, this is just want to go over so you understand which vaccines that we have. And this, I'm just going to put this pretty picture of, we've gotten used to looking at COVID-19, but the reason I put it up there is so that you'll understand some of the conversation that I'm going to be having going forward. And more importantly, the little red spikes, which are spike proteins.
We can't see your presentation, Dr. Powell.
Oh. So I've been talking this entire time without the presentation being shared. Okay. Let me see. Screen. Can you see the slideshow now? Are you able to see the slideshow?
Yes, we can see the title page.
Okay.
I believe if you go through, we'll be able to see it now.
I apologize for that. So basically, these just going through these slides that we were talking about before, which were the variants, the different vaccine variants, and their effectiveness against the different variants. And this is just the slide I was discussing with the rates of deaths and hospitalizations in the Black and Hispanic communities. And this is a picture of Dr. Corbett that I was just talking about. So now we're getting to the picture. This is where I left off, which was a picture of the virus itself. And the little red spike proteins is where a lot of the science behind these vaccines occur. So I just wanted to create that picture so that it'll be in your mind. Currently approved in the United States with under emergency use approval is 3 vaccines. The Moderna and the Pfizer vaccines are microsomal RNA vaccines, and I'm going to go through what that means and how they work. And then the Johnson J&J vaccine, which is an adenovirus, it's a vector vaccine. It's more of a traditional way of delivering vaccines that you're used to by using a killed or a deactivated type virus to introduce the information into our cells. So I just wanted to go over some comparisons so that you're familiar with the different vaccines The Moderna and the Pfizer vaccines, in general, their effectiveness is 94 to 95% with general COVID-19 virus to prevent you from getting general symptoms. And the J&J vaccine is 66%. And the effectiveness with people with chronic illnesses from developing disease or symptoms, it's about 90% with Moderna, 89% with Pfizer, and about 85% with J&J. I know there's been some attention, and people tend to think with the J&J vaccine, because you see the number 66, that it's not as robust a vaccine as the other two. But two things I want to bring into your attention is that the J&J vaccine has been developed with the variants in mind. So it's an effective vaccine against all of the current variants that are out, that are in circulation. And also, 66% is still a very high number in vaccine world in preventing general illness. Now, all the vaccines will prevent 100% death, and then severe illness. All three vaccines are very effective against that, and that's where your goals are going to be. The Moderna and the Johnson & Johnson vaccines are approved for 18 years and older, and the Pfizer vaccine is 16 years and older. They are currently doing studies and looking into the pediatric population to eventually approve these vaccines down in that age group as well. The Moderna and the Pfizer are 2-dose vaccines. They are, for Moderna, usually 28 days apart, and for Pfizer, it's 22 days apart, but they each can be given up to 6 weeks apart and still fall within the range that is acceptable. And even if, for whatever reason, you're not able to meet that 6-week deadline, you do not have to start the vaccines over again. The Johnson & Johnson vaccine is a 1-dose vaccine. None of the vaccines contains eggs, latex, or preservatives. There's been a lot of questions about stem cells, embryonic stem cells, which have been historically used in creation of vaccines and other medicine. Neither the Moderna or the Pfizer has stem cells in them. The Johnson & Johnson did use embryonic stem cells in the creation because of the virus. You need to use stem cells. Now, I just wanted to bring your attention that these stem cells, this embryo is from the 1970s. And so they've been growing this cell line for decades. And so it's really just the cell line that they're using. There's no active embryos being involved in these science. I wanted to explain to you how microsomal RNA vaccines work. Microsomal RNA or mRNA is what tells your body to produce proteins, and your proteins are what give you antibodies, which will help you fight the disease. So for the microsomal RNA, they basically that spiked protein, they took the sequence of the RNA and they wrapped it around in fat, because if they were to just introduce that microsomal RNA into your body, it would be destroyed immediately. So they wrapped it in fat, and with that, it's able to attach to your cell. It delivers that sequence into your cell, and then it teaches your cell how to produce antibodies. And soon as it's injected and the body picks up that message, it disintegrates out of your body. So that microsomal RNA does not stay in your system, nor does it ever enter the nucleus of your cell where your DNA is stored. So it does not have the capability of affecting your DNA whatsoever. And it is also has nothing to do with it being a live virus, so it cannot make you ill. And this is revolutionary science they're using with these vaccines with microsomal RNA technology, which, by the way, has been studied now since past 30 years. They started studying this technology. So, and I will get into some misgivings about warp speed and what that means. The J&J vaccine uses a more traditional way of introducing that DNA into the body. Now, this uses DNA, but it's a little piece of DNA from, again, that same little spike protein. And that is wrapped and delivered into the cell by using a very inactive, harmless virus that is adenovirus, which usually causes you a cough or cold. But the adenovirus is not a live virus. It is only, it is deactivated just so it can use itself as a portal to enter into your body to create the same process to teach your body to make antibodies. It does not, once again, it does not and cannot recreate itself. It cannot cause COVID-19 to be infection in your body, and it cannot interact with your DNA. That's just more pictures. So some understanding of this Operation Warp Speed, which has, no one felt warm and fuzzy when you're talking about introducing new science, and it's called Operation Warp Speed. And it gave the impression that these vaccines were developed overnight, and that they were not safe, and that they did not go through the normal chains of scientific trials that normally happen with vaccine process. So for one, I mentioned this briefly earlier, for Microsomal RNA, they started working on this technology back in the 1990s. And they had been developing and working out, first developing RNA and using it as a way to teach cells to fight different diseases. And then they started thinking about using it as a vaccine. And then came the pandemic. And what made this us able to get this vaccine to the public so quickly is, one, you had for the first time communication and cooperation of hundreds, it's over 180 research labs throughout the world, unprecedented, and about $24 billion were poured into this vaccine research. With that, they were able to still go through all these phases. So you see this trial, phase 1, phase 2, phase 3, phase 4. What they did was they were able to, they had so many people that were researching this and so much funds put into it, they were able to collapse and do things simultaneously without affecting the integrity of the science. So while they were getting people enrolled in the clinical trials, as soon as they saw that the data was coming back favorable, they started producing the vaccine. So this whole process of the 15-month process for producing the vaccine was happening at the same time as the trials. And then they were able, once approved, to have the vaccine already developed and able to go to the public. But just to reiterate that they went through the same vigorous studies and evaluations that any other vaccine has had. It is just unprecedented, the amount of money and the amount of cooperation with the different labs. Just to go over what's in these vaccines, because that's another question people have. And the microsomal RNAs are very simplified. It is just that little piece of RNA that's basically that code that you're going to use to make the spike protein. And they wrap that in fat. So these are all just fats and some salts and sugars. That's all that's in the Pfizer and the Moderna vaccine. The J&J vaccine is just that little microsomal RNA, and it's inside a killed, deactivated, ineffective adenovirus. So these are very simplified vectors, the way they're using them. Just wanted to go over the fact that these trials initially did have people of color in there, and they did different age groups. They did different nationalities, Blacks and Hispanics, Asians, American Indians, all were included in these original studies. So there was initial data about the safety within these groups. And this is just the fact that the J&J vaccine, these are the different regions that the vaccine was, the trials were done in. And the fact that the vaccines were also tested with people with underlying medical conditions as well. So getting to vaccine safety, because one, that's a big question. Are these vaccines safe? Are they safe when I am healthy? Are they safe if I have disease or have underlying conditions? The safety profile for these vaccines has done phenomenal. Now, what they call side effects really are not side effects. It's a poor term to use, because when you get the vaccine and you hear that people get fever and they get pain and they get headaches and vomiting and nausea, really that's just your immune system gearing up against the vaccine. They're not side effects per se. And just so you know how with vaccines, and I'm a pediatrician by trade. I've dealt with vaccines all my career. And with any vaccine, if there's anything that happens to a patient, once you get a vaccine that is unexpected, it is reported. You report that into a federal system, and they take a look at that data. And they start to look at to see whether or not that side effect or that outcome is associated with the vaccine, or is it the percentage rate no higher than it would have been if people did not get the vaccine. And so far, with all the different categories, you may have heard about some people with some blood clots. They've looked at these things and they are not finding it happening at any increased rate than people normally have these things without the vaccine. So are these, who can and can't take the vaccine? Are they safe? So people with a weakened immune system, it is recommended that this group of individuals get vaccinated. They are at the highest risk, one of the higher risk groups of getting severe COVID-19 and dying from the disease. Now, the only thing we'll talk about with that is not that they would be overwhelmed with the vaccine. It would be that because their immune system is weak, that they may not respond and have a full response to the vaccine. So their immune response may not be like someone who did not have an immune system issue. However, it would be better than when they did not have the vaccine at all. So they would have more protection. Same with people with autoimmune diseases. They do not have any specific data when they were doing the trials with autoimmune disease, but because of the nature of how the vaccines are made, because they're not live viruses, because they're not, it's just a piece of that protein, and it's not a whole COVID-19, then they deem this safe for all people with autoimmune disease to take these as well. And it's always recommended that if you have any of the following, that you talk to your doctor and you discuss what's right for you. Now, people who have Guillain-Barré syndrome, and that is something that we've seen. This is a well-known disease state. It can cause paralysis that starts from your feet up, and it can be caused by viruses. They looked into that, and you may have heard something about Guillain-Barré and should I take the vaccine? When they did the trials, they found that there was just one person in the J&J vaccines that got Guillain-Barré, but they also had one person in the trial, that the placebo that didn't get the vaccine that had Guillain-Barré, which of course does not meet the standard for you to exclude these people from getting vaccinated or to think that there's a cause from the vaccine. Pregnant women, there were no direct data back initially with women that were pregnant. However, again, they have said that it's safe for women. They believe, or with the history of the fact of the way the vaccine is developed and the nature of it, that pregnant women are safe to take it. Now, since the vaccine has been on the market, there have been pregnant women that have taken this vaccine, and they are currently studying the outcomes from that, and there has not been any adverse outcomes yet. A very latest unique thing that they're starting to see is that pregnant women who have taken these vaccines, that the baby has immunity. So they're seeing antibodies in the baby, they're seeing in the fetus that the baby is getting immune and protection from the pregnant women who have taken that vaccine. And the same thing for breastfeeding. That is something that was not tested, of course, but they are having women that are currently breastfeeding and women that have taken the vaccine. So they're looking at that data as well. Again, this is a conversation you have with your doctor. Make sure it's right for you. However, pregnant women are at a high risk, can get severe disease. And people who have had Bell's palsy can also get the vaccine. There have been episodes of Bell's palsy, but it's been no higher than the normal public that prior to the vaccine. So there should be no reason that you cannot get them. Some of the myths around vaccines. Can COVID-19 vaccine make me sick with COVID-19? And the answer to that question is no. And for the same reasons I said before, you do not have a live virus. It has no ability to make you sick. It's like saying, can a finger be a whole person? it just doesn't happen, and it cannot happen just because of the mechanics of the vaccines. After getting a COVID-19 vaccine, will I test positive for COVID-19 on a viral test? The vaccine will not cause you to be positive on the COVID-19 PCR test, the antigen test. So if you get the vaccine, let's say you get the first dose and you get tested and you're COVID positive, you should treat that like you would if you were not vaccinated. It is not because you got the vaccine. Now, the only study that can become positive from the vaccine is the antibody study, the COVID antibody. But that's because that's what your objective, or what you're trying to get with the vaccine, is to get your body to make antibodies. So that one you can become positive, but that's fine. It's just picking up your immune response to the vaccine. If I've already had COVID-19 and recovered, do I still need to get vaccinated with COVID-19 vaccine? And the answer is yes. One, they don't know how long your immunity will last. It's always better for you to get protected with the vaccine than not. And it can also improve your chances of being reinfected with the vaccine by being vaccinated. So it is still recommended. Now, if you have COVID, you want to wait until your quarantine is over before you get the vaccine. And if you get COVID-19 vaccine and you get the monoclonal antibodies or convalescent plasma as a treatment for that, you want to wait 90 days before you get vaccinated. And the reason is because these treatments are designed to fight off the disease, and you may not respond to the vaccine. So you need to wait. The last one is, will COVID-19 vaccine alter my DNA? And the answer to that is also no. I went over it a little bit earlier. It never enters into a part of your cell where your DNA lives, or for either the groups or types of vaccines. So it cannot alter your DNA. Okay, I just wanted to give you some updates of where we are with vaccinations right now. This is for New Jersey. We currently have all 3 vaccines in New Jersey. And we have now, and these numbers are even higher than, this is from March 21st, we're 1.2 million people fully vaccinated. But in saying that, we still have a long way to go with the people, brown and black people of color. As you can see, we're about 5% for African Americans, 7% for Hispanics being vaccinated in New Jersey. And this is the number breakdown for Union County in particular. So we are still working, and we still have a lot of work to go. Our goal for our lives to truly go back to normal is to get 70% of the population vaccinated. And right now we're at about 20%. So we still have a while to go, but we're looking forward to getting there. What to expect when getting vaccinated? Most of the vaccination centers, you will be asked to fill out a questionnaire that basically asks you some questions about your allergies, whether you're pregnant, whether you have underlying conditions. And that's how we are able to figure out whether your observation time. So when you go to get vaccinated, they're going to observe you maybe 15 minutes or 30 minutes, depending on how you respond to that vaccine. The only group that you will exclude from getting vaccinated is, again, those people who recently received plasma or antibodies, or those people who are actively sick with COVID because you don't want to get the staff sick, or someone who had an adverse or anaphylactic reaction to the first vaccine. If you have a history of anaphylaxis, you can still get the vaccine. It does not mean you will automatically have an anaphylactic reaction to this vaccine. And personally, we have vaccinated several individuals and several of our employees who have severe history of anaphylaxis with other things, and they did fine with the vaccine. So please don't let that keep you from getting vaccinated. Now, whether you're getting the 2-dose or the 1-dose, common reactions is pain at the injection where you get your injection site. You may get soreness in that arm. You may get fever, and for a small percentage of people, that fever can be quite high, but for the most part, it's a low-grade fever. Some people get chills. Some people get headaches, nausea, vomiting, diarrhea. Very small percentage of people have that response, but if you're going to have it, it's going to increase your chances in the second, after the second dose. And that's because your immune system is like, hey, I've seen this already, and it's going to have a stronger response the second time. But for the majority of people, they're very minimal, if any, and I'm not going to use side effects, but symptoms after getting the vaccine, symptoms of your immune response. Most people do perfectly well with that. And I got my vaccine, and I got it in December, and I have been fine since then. And I just wanted to leave you with some resources to figure out, how do I get a vaccine? How do I get my questions answered? Both New Jersey and the health center in particular, we have resources to help you. But these are state sites and state numbers that you can call. If you have medical questions, they can get you registered, help you find the other vaccine sites if you can't get here in Plainfield, or if you know people outside of this area that needs to get vaccinated, then these are some resources for you and some numbers for you to use and take down. And these will, I'll just give you a minute, but that's the pretty much it for me. And thank you for giving me this time.
Well, thank you so much, Dr. Powell, for that presentation and for all of the information that you disseminated here this evening. I am sure that our residents and those in the listening audience or the viewing audience, they benefited from what you shared with us this evening. And I suspect that we have a number of people who are listening and watching who have some questions. And so we invite them to present their questions, and I know that you will do your best to answer. And if there are questions directed at either Director Brown or myself, we would also attempt to answer as well. So let's hear the question. I see there's a question that's being typed that asks, will the presentation be available? And I know that Jen will be handling the questions, so she will pick up from here.
Okay. So I absolutely can share my presentation. This is all about you having knowledge, so I will make that available for anyone that would want the presentation.
So for Spanish speakers, I will be translating the questions and the answers. And the first question is, la primera pregunta es, ¿estará disponible esta presentación? Y la respuesta es sí, ella va a tener la presentación disponible para ustedes. Okay, the second question, can someone who has been vaccinated get COVID, be asymptomatic, and thereby pass it on to someone who has not yet been vaccinated?
So they did look into that, and that was one of their concerns initially, but what they're finding is that people who are vaccinated are not passively giving the virus to people who are not vaccinated. So the vaccine is protecting both the person themselves and also preventing spread of the disease to others who are not vaccinated.
La pregunta es si alguien tiene la vacuna, si le pueden dar COVID-19 a otra persona ya estando vacunados. Y la respuesta es que no encuentran que ahora mismo están las personas enfermándose si una persona tiene COVID, si tiene la vacuna de COVID-19. No se está transmitiendo con la vacuna. The next question is, where are the vaccination centers, in Plainfield or Union County?
So Neighborhood Health Services currently has vaccine, and also the Plainfield Mayor Mapp and Shep are partnered with Union County as well, and we're vaccinating between the two groups, are providing vaccines weekly in Plainfield.
La pregunta es, ¿dónde están los centros de vacunación? Y ahora mismo están dentro de Union County en Kent University, también Neighborhood Health Services en Plainfield. Someone has a comment. I received my J&J vaccine on Sunday, and I'm grateful. Thank you for this presentation.
Fantastic.
Very informative. Thank you. And someone says, very thorough explanation. Thank you, Dr. Powell.
No problem.
Si hay personas latinas presentes que tienen preguntas, estoy aquí para darles información. I see a question here. Will there be a translation in Spanish for all the information that was given? Si esta información estará traducida para las personas que hablan español, and I will say yes, this information will be given in Spanish to
our presentation. So
yes,
you can do with it what you will, get it out here to the people.
Of course.
This pregnant pause is because we're waiting for more questions to come in. What does it look like, Jan?
I'm not seeing any new questions right now. Okay, I see something here. I received the Moderna vaccination today at CVS. Oh, there needs to be more local sites. So just another question, I guess, about local sites in Plainfield.
So yeah, and they neighborhood is on the state vaccination list as a site. And so if you go to the website, you will see information. What we are doing is, in order to keep the vaccines local, is I'm working with Mayor Mapp and Shep Brown so that the doses stay local. So that's why we kind of shut down the public vaccination. But we'll work at being creative about getting access. But we are looking to vaccinate the community. So we're here. And we're vaccinating every week. And we're going into the senior buildings as well locally and trying to do as much as we can, as well as Mayor Mapp and Shep working with the county. So between the two, it's still a lot more vaccine coming, but still not enough. So it's going to be continued, and it should be improving with the supply of vaccine. But I think that is where the major issue is, that up until recently, the vaccine supply has been very slow, but it's starting to improve.
Okay. La pregunta era sobre los lugares de vacunación de COVID-19 y la respuesta fue: los sitios locales en Plainfield están en la lista de vacunación del estado y estamos haciendo todo lo que podamos para que las vacunas sean locales, y también estamos juntándonos con Union County para mejorar la situación del suministro de vacunas.
And may I just say, you can call the health center. If you want the vaccine, call the health center. We will get you registered. So just call the center to get the vaccine.
Si quieren registrarse para la vacuna, pueden llamar al Neighborhood Health Center y ellos te ayudarán con eso. Next question, how can people get the vaccine in Plainfield? I think we just kind of went over that.
So I will say that the number for Plainfield Health Center is 908-753-6401. So if you need the vaccine, give us a call. We will get you situated to get vaccinated.
And to repeat, that was 908-753?
6401.
Okay, si se quieren registrar para la vacuna, pueden llamar al centro al 908-753-6401.
And I just want to say, you do not have to have insurance to get vaccinated. I cannot say this enough. You can be undocumented, you can have insurance or not, you can still get vaccinated. So please do not let that be the barrier for you getting yourself to us to get a vaccine.
La doctora dice que no tienen que tener seguro para ser vacunados y pueden ser, no tienen que tener documentos del Estado.
If you are insured, there will not be any out-of-pocket costs. So you won't receive your dreaded copay and your deductible and all those things that you usually will receive. You will not get any of that when you come to get vaccinated.
Y si tienen seguro, no se tienen que preocupar por gastos fuera de bolsillo del seguro. See a question here. What percentage, or I'll do this one first. Can you repeat the information you gave about someone who has gotten the first shot and had COVID? How long should they wait before the second?
So if they did not get plasma or antibodies as a treatment, then they would wait the customary 14 days to get the second shot. Or, they could go, as long as they're been cleared from quarantine between the first and the second shot. And you don't have to worry that you're not right at that 1 month for the second shot. Again, I say you have up to 6 weeks and you can actually do longer than that. So if you get any of those antibody treatments as part of your COVID-19 infection, you need to wait 90 days before you get the vaccine, because the vaccine won't be effective if you do it before then, because those antibodies are designed to help you fight off COVID, but it'll also help you. It won't allow you to create an immune response to the vaccine. So that's why you need to wait. But otherwise, just as long as you're not infectious.
Okay, la pregunta es sobre una persona que se vacunó por la primera vez y le dio COVID antes de la segunda vacuna. Y la respuesta es, si no recibieron anticuerpos en su tratamiento, que esperen 14 días para recibir la vacuna, siempre y cuando hayan sido liberados de la cuarentena. Tienen hasta 6 semanas. Y si reciben algunos de esos tratamientos con anticuerpos, deben esperar 90 días para recibir la vacuna. Next question is, what percentage of the population needs to be vaccinated before we can stop wearing masks?
The goal is 70% of the population in order for us to truly start having any herd immunity and for us to be safe to go a mask without wearing masks. So that's the goal. And we're at 20% now.
Okay. La pregunta es, ¿cuál es el porcentaje de la población necesita ser vacunados para que no tengamos que usar las mascarillas? Y el goal es 70% de la población y ahora mismo estamos a 20%. I'm assuming this question means, how are you reaching the homeless population?
Maybe homeless or homebound. Both of them are conversations.
Right.
The homeless population, different FQACs and different facilities in the state are partnering to handle the homeless population using mobile units. The homebound, working with the state as a project to figure out how to vaccinate the homebound population. It's very tricky with these vaccines, because once you open up or you puncture a vial, a clock ticks for you to have to use that entire vial. So we are feverishly working on ways to start vaccinating homebound, and we meet every day. The state, New Jersey Department of Health, with all the vaccine programs, we meet every day and we talk, and we're having conversations about how to get those populations vaccinated.
Okay. La pregunta es, ¿cómo está llegando las vacunas a la población sin hogar? Y la población sin hogar, bueno, el Estado está trabajando para resolver esto, así como con las personas confinadas en sus hogares, están trabajando en formas de comenzar a vacunar los que están confinados en la casa, pero ahora mismo están trabajando fuerte para ver la solución. Okay, next question is, can people who received their second shot gather with one another without their masks on, hug, etc., without social distancing.
So some good news. Now, after you get your second vaccine, you need to wait at least another 2 to 3 weeks before you are considered immune. So that's important as well. So either if it's the J&J vaccine, about 2 to 3 weeks after that first shot, or if it's Moderna and Pfizer, it's 2 to 3 weeks after the second vaccine that you're considered immune. If you are immune, you can be around other people who have been vaccinated and they are immune without masks. You can go visit them in the home. If you're vaccinated, they're vaccinated, you can mingle with each other without face masks. But just if you've been vaccinated, I don't want everybody to put the Superman cape on and think I can go and run free and and feel like you can't be at risk. So you really still should continue to social distance, wear your face mask when you're out in public, do all those things, but you can interact with other people who have been vaccinated in small groups in your homes or in small gatherings. You can do that without face masks.
Dr. Powell, can I interject here? So I've gotten a lot of questions around the fourth wave. Have you gotten those as well?
Well, it's been, some people feel like the fourth wave is coming, and then some scientists are saying it may not be as bad as we think. However, I think there's a false sense of security that's happening right now because the vaccines are here. We were only vaccinated 20% of the population. So that's 80% of the population not vaccinated. And every time someone passes infection to another person, there's a chance there's a variant that will happen that can be more infectious or make you more sick. So we are by no means out of the woods when it comes to COVID-19. So everyone should still be very diligent because you see those spring break videos and everybody's sitting under each other. There is a fear that there is going to be a marked spike in rates. And we're seeing it in Italy and France now that they're having to shut back down even. And they're usually our canary. They usually, what happens to them is happens to them first, and it usually spills over to the United States. So we still really need to be very, very careful.
Para traducir la pregunta anterior, pueden reunirse las personas que reciben su vacuna y la doctora dice que es necesario esperar de 2 a 3 semanas antes de que se considere inmune. Si tienes la vacuna, puedes estar cerca de otras personas que también están vacunadas sin mascarilla. Cuando estén fuera de eso, pueden distanciarse socialmente y usar mascarillas cuando no estén con personas que se han vacunado. The next question, I've been administering COVID-19 Moderna vaccines at the Department of Health in Newark, New Jersey. I am a registered nurse and would like to participate in administering vaccines in Plainfield. Where can I go to apply?
908-753-6401 and ask for Andrea Taylor. I don't know if, Shep, I didn't want to snatch her from
Oh, you did. You were quick. You've always been quick. I've always been impressed by that.
That's perfectly okay, Dr. Powell. We want that person involved. So
that's correct.
Let that person assist at the Neighborhood Health Services Corporation. Now,
thank you.
Now, I have a question, Dr. Powell. I heard a presentation from Dr. John Porter, who is with Cooper Medical in Camden. And he said, I heard him about 2 or 3 weeks ago. He said that, as you know, the direction from the CDC was that if you contracted COVID-19, you had to wait 90 days before you get the vaccine. Dr. Porter said that if you contracted COVID-19 and you recovered and you're free of symptoms, that you can get the vaccine 2 weeks after. Can you speak to that?
And I think that's kind of what we were speaking to that, and it's been some confusion with that. yes, if you get COVID-19, then all you have to do is wait till you're finished with that quarantine period and you're asymptomatic and you're medically cleared, which is typically about 2 weeks before you can get your second vaccine. The subgroup of people that have to wait the 90 days are if you get infected with COVID-19 and they treat you with antibodies, those plasma antibodies, those individuals do have to wait the 90 days. And there has been some confusion back and forth about the 90 days because even some individuals were saying if you got infected naturally and without the antibodies, you should wait 90 days. And I think there's confusion because people who get infected with COVID-19 have a assumed natural immunity for 90 days. So very in the beginning with the vaccines, they were saying, if you got COVID-19, you can wait 90 days if we can get vaccinated. You're pretty covered. And I think it has created some confusion now between using that term 90 days with people who've been infected. By all means, if you got the first dose, you get COVID-19 and you did not receive any of those plasma treatments, and they will tell you, and if you don't remember, call them, then you can get vaccinated as soon as you're medically cleared to be around individuals by your health department. And then you can get the second dose vaccine.
Yeah, what if you never had the first dose and you had COVID-19? Is it 2 weeks or is it 90 days?
If you've never had the vaccine, then you can wait again when you're medically cleared to get the vaccine. Now, they say initially they used to say you don't have a rush, you can wait 90 days. That was also, I think, a lot to do with in the beginning, we had so little vaccine. They were trying to distinguish between at least these people have maybe 90 days where they could be okay and we can focus on people who've never been infected type of approach. But since we've gotten more vaccine available, really, if you can get the vaccine, whether you've gotten COVID or not, go ahead and get vaccinated. If you're medically cleared.
That's exactly what Dr. John Porter said.
Mm-hmm.
So thank you for explaining that.
No problem.
La pregunta del alcalde es, si has contratado el virus, ¿cuánto tiene que esperar para ser vacunado? Y la respuesta es, si contrae COVID-19, todo lo que tiene que hacer es finalizar su cuarentena y obtener la autorización médica antes de su segunda vacuna. Si no ha recibido los tratamientos con plasma, puede vacunarse tan pronto como tenga la autorización médica.
Jazz, do we have any additional questions from the listening audience?
Let's see. Okay, are the vaccinations right now at Neighborhood Health Services in Plainfield? How do I register?
Yes, they are. And thank you for putting that number up. And the reason I keep referring you to the number and not the website is that we closed registration on the website because we were beginning overwhelmed with a lot of people from around the state and not enough people who were local. And that's why. So we do have a registration process that you can go through. And if you call that number, we will get you registered and talk you through the steps on how to get registered.
La pregunta es si hay vacunas en el centro y si me puedo registrar. Y claro, el número de nuevo es 908-753-6401. Ahora mismo el sitio web está cerrado para registrarse. Next question. Once you get your second shot of Moderna vaccine and you experience side effects and cannot work, will our jobs give us a COVID-19 day off?
Well, it has not been officially mandated, but I will say people, when we were initially having a conversation about vaccines, they did say if you be lenient with your staff, especially those who do experience, more severe symptoms, to give them a day off for that. I cannot speak for every employer, and also, again, planning with your employer about people who get the vaccine. You don't want all the people out at the same time, but yeah, that is with the policies with that individual person, but it's not been mandated by the state that happens.
And I would add that every situation will be taken on its merit and will be dealt with accordingly.
Mm-hmm.
La pregunta es si yo tengo COVID-19, si me van a dar un día libre del trabajo y ahora mismo no es obligatorio y el Estado no tiene mandatos, pero depende de su empleador y cada situación será tomada por su mérito. Next question. I am a Plainfield resident and I've been on the list to get vaccinated for over a month and still haven't heard anything. I am a former law enforcement officer and I have underlying circumstances.
Alan, can you, I hate to be repetitive, but can you call the health center? I know we are working for for the Plainfield first responders, law enforcement. We're working with getting a registration link for you all to get vaccinated with the city, and so that you would have some access that way as well. But if you can give us a call, we can get that taken care of.
Esta respuesta, la pregunta es, yo trabajaba en la ciudad y todavía no me han dado mi vacuna. Y la respuesta es que pueden llamar al Neighborhood Health Center al 908-753-6401. Is there only one vaccine location in Plainfield?
So I don't know, Shep, if you wanted to. So the health center is vaccinating, and then I'll let Shep answer for.
So the county is vaccinating throughout Wednesdays at the Plainfield High School. That's definitely happening. But I also know that you can make appointments with CVS or Walgreens. Those appointments are hard to come by. That's why Dr. Powell and I and the county have been working diligently to get people vaccinated in Plainfield. The other thing that you can do is contact, and I'm going to put a plug in for the city, is contact the senior citizens office. And that number is 908-753-3506. And we have turned the senior center employees into almost like a call center of information. And so we do refer not only to the neighborhood health, but we help people with Union County as well. So those are two options. I mean, those are two active options that we have going on in Plainfield right now. And I will say, that is a lot more than a lot of other cities actually have. If they don't have a Walgreens, if they don't have a pharmacy, they don't have that. If they don't have a health center that's actively involved, that's eliminated. And so it really is the fact that we have two active agencies working in the city of Plainfield to get us a resource that is very limited. Very limited.
La pregunta.
Go ahead.
I'm just saying that we really have a very great partnership. We are in communication with each other to do the best we can to get and recognize anybody needs to be vaccinated and getting them registered and getting them taken care of. And we've been doing a lot of, the partnership is very strong. And I commend Mayor Mapp and Shep Brown for that partnership. It really does help for us to accomplish this Herculean task, but we're really doing the best we can to get it taken care of.
La pregunta es si hay un solo lugar de vacunación en Plainfield. La respuesta es el centro de salud, el Neighborhood Health Center, es donde se está vacunando en Plainfield. El condado también está vacunando los miércoles en el Plainfield High School. También, si quieren, pueden ir al CVS o el Walgreens y pueden llamar al Senior Center al 908-753-3506 para obtener más información. Someone asked, is there any specific person I should ask for in this senior center?
That's Alan Strickland. He was a law enforcement officer. So Alan, if you're going to call the health center, you can ask for Andrea Taylor. If you're calling the senior center,
the line is open, so they will pick up and take any information and talk to him.
Okay.
Si están llamando al Neighborhood Health Center, pueden hablar con Andrea Taylor, y si están llamando al Senior Center, eso es algo abierto y quien coge el teléfono lo puede ayudar.
No problem, Alan. I did want something I forgot to say is these vaccines are not interchangeable. So if you have a 2-dose vaccine and you start with Moderna, your second dose needs to be Moderna.
Right.
Same with Pfizer. If you start with Pfizer, your second dose needs to be Pfizer. So you should not mix and match the vaccines.
I have a question, Doctor. If I got my first vaccine in the Meadowlands, can I now come to you to get my second dose? Or do I have to go back to the Meadowlands to get that?
They recommend that you go back to the person that you received the first dose, because the state ships the second dose supply to that facility. However, we would not turn you away. We try to accommodate you if you need to get your second vaccine, and for whatever reason you can't get back to the original place you got your first vaccine. We'll do our best to accommodate that.
La doctora quiere que todos sepan que estas vacunas no son intercambiables, y una pregunta de Shep Brown es: si recibo mi primera vacuna en un lugar, ¿puedo ir a otro lugar para obtener la segunda? La respuesta es que recomienda que vayas al lugar original de su vacunación. Sin embargo, no serán rechazados.
I think you're talking about Shep, the Wednesdays county.
So the county on Wednesdays dispenses the vaccines. The registration is held before that. So you would have to first get registered and then assigned to the high school.
And the same pretty much works for the health center. You call and they register ahead of time. So we don't do like a walk-up or a walk-in vaccination program. So you would get pre-registered and you'll be told what date you're going to be coming in to get vaccinated.
Para los dos lugares de vacunación tienen que registrarse antes, no pueden caminar hasta la locación.
And do I need a cell phone number or an email address to register? And if so, why?
You go first, Dr. Powell, and then I'll go.
So yes, we do require cell phones, email address, and insurance information if you do have it. It helps with us to communicate with you, scheduling the appointment, performing follow-ups, and scheduling for the second appointment, and also the insurance information. We do bill the insurance for the administration of the vaccine. That's why we're able to continue services. But again, it would not be any out-of-pocket expenses, but we do use that communication to call you, to let you know if there's any changes, to give you reminder information. So we need a live or active contact information for you to participate. Now, if you do not have, a lot of the registration forms are electronic or through the computer, but if you have problems doing that, you can call and someone can assist you with registering.
The same is true for the county in the registration process. They do ask for distinct emails, because emails, so if it's a husband and wife, they ask that it not be the same email, because that's part of the registration process. And they do ask to have distinct cell phone numbers. However, what the county and the city has discovered is that when it comes to our seniors, they don't have multiple emails, if at all. And some of their cell phones don't receive messages. And so what we have asked is to use a caretaker, a child or a regular caretaker, someone who will be responsible for getting you the information. And that's been working out for the county, for sure.
And if I am homeless and I don't have a cell phone or an email, does that mean that I can never get the vaccine?
No. Well, I can talk about what's going on with the county, and then you can talk, Dr.
Mm-hmm.
So that has been one of the biggest challenges. The the homeless community. So what RJW Foundation and hospital have done, they partnered with United Way and various cities, of which City of Plainfield is one, to begin to work on vaccinating the homeless. And they're looking to try to do it with J&J only because it's a one-shot experience. I know ours is next week, the 31st, where we'll be doing homeless vaccinations. We're working through with the police departments. We have been working with nonprofits to help identify those individuals. But the challenge around homeless is that they may not have a cell and they may not have an email. And so that has been a challenge in how we get the homeless vaccinated. It is a national challenge. I don't know how you're going to do it any different or how you're doing it. I know that you're working on the Park Hotel because that has been a concern of the community. So I don't know if you want to talk about that as well.
So we we did the first dose vaccination today. We actually went on site to vaccinate Park Hotel, and what we did was we had the staff there helped us to register the residents there prior, and we went on site to vaccinate them to eliminate the challenges of them traveling to the facility. And what we've been finding, like with our senior facilities and like with Park Hotel, we've been using the email of the facility to contact the residents. So that has been a helpful tactic as well, because a lot of the individuals may not have cell phones or individual email addresses, so they'll have the email address and telephone number for the facility. And like Shep mentioned with the homeless, that has been a national project and a statewide project. We're trying to figure out the best way to go about vaccinating the homeless, and so much of what Shep said is the same.
Ok, hay dos preguntas aquí. ¿Necesito un número de teléfono celular o una dirección de correo electrónico? Si es así, ¿por qué? Requerimos teléfonos celulares, dirección de correo electrónico e información del seguro si los tiene. Nos ayuda con el registro. No hay gastos de bolsillo. También funciona para recordatorios sobre la vacuna. Lo mismo ocurre con el condado. Solicitan correos electrónicos y números distintos entre las familias, por favor. Otra pregunta es, ¿qué pasa si no tengo hogar y no tengo un teléfono celular o correo electrónico? Y la respuesta es que ese es uno de los mayores desafíos. El Estado está encontrando formas de vacunar a las personas sin hogar con la vacuna de J&J de solamente una inyección.
Very good. Any closing comments, Dr. Powell?
Once again, I just want to say, please, please, please get vaccinated. I think it has been an extraordinary time, and what I would want for you is to protect yourself and protect your family. So please, when you get a vaccine, and all 3 vaccines are perfectly fine. Don't feel like one vaccine is better than the other. Whatever one you are able to get vaccinated with first, take the opportunity and get vaccinated and protect yourself.
Any closing comments on Director Brown?
Dr. Powell pretty much hit it on the head. I will add that testing is still important to our community, that we should continue to get tested, particularly as we roll out the vaccines. It is still critical that we do that. And if to the residents, if you want to get back to normal, if you want to get back to sharing and spending time with your families, hugging your mother and your grandmother, letting them hold your newborn child, we have to get vaccinated. We have to do these things. We have to do all these things are important for us to get back to what was normal and to get back to what our lives should be. And if we don't do this, we'll constantly be in this state of wearing masks and not being able to share time with those we love most. Please pursue vaccination and pursue testing as well.
Well, you've heard from Dr. Powell that you can get any of the 3 vaccines. And so I have heard an ad from New York City that says the best of the 3 vaccines is the one that you can get.
That's right.
So make sure you take the vaccine. I must say that I am grateful for the triangular partnership between the Neighborhood Health Services Corporation, the Union County Board of Commissioners, and the City of Plainfield. It's by the three of us working together that we've been able to bring vaccines into the City of Plainfield. And I know that through that partnership, we have administered thousands of doses to people across the city. And so I appreciate the work that you're doing, Dr. Powell, at the health center, and we appreciate the partnership. And I can't say how grateful I am to Director Brown for being the Energizer Bunny, working around the clock to make sure that we provide a level of service to the people of Plainfield that they need and deserve. And so to all of you that are listening, you've seen the numbers posted on the screen. We encourage you to call the numbers for assistance in getting registered and getting vaccinated. So thank you. Protect your families. Don't let your guards down. You still must wash your hands. You still must wear your face shield or your face mask and socially distance. And if you do that, we will all be safer and better off, and our families, our city, and communities will be protected. Thank you. May God bless each and every one of you.
Thank you. Thank you.